Hello, this is Ginny Brant with Unleash Your God-Given Healing with Lifestyle Changes. Today we're going to look at 9 facts you must know about Alzheimer's disease. Alzheimer's disease affects memory, identity, and relationships. Understanding it helps us to respond with wisdom and compassion. It is a progressive brain disease causing memory loss and cognitive decline. Key features that help to identify it include amyloid plaques and tau tangles as viewed on brain scans. Doctors use cognitive tests, blood tests that measure beta-amyloid, a protein that accumulates abnormally in the brains of Alzheimer's patients. They also use urine tests and perform brain scans such as a CAT scan, or what we call CT scan, an MRI or magnetic resonance imaging scan, or a PET, or positron emission tomography test. Sometimes they collect spinal fluid via a spinal tap that measures levels of proteins associated with dementia. I know too well what this dreaded disease can do to the patient and also to the loved ones and caregivers. Hear me clearly. This is a disease you want to avoid. And here are some facts you must know about Alzheimer's disease that will help you with prevention. Number 1, Alzheimer's is not just memory loss. It's a disease that affects language, judgment, personality, and behavior. There are 5 A's to this disease: amnesia, and it's often the first recognized symptoms of Alzheimer's disease. It's simply the loss of memory. Short-term memory is usually affected first. This is why you will see your loved one ask the same question over and over again, or tell the same story over and over again. I remember my father telling me an important story from his past. Then 10 minutes later, he'd tell me the same story as if he hadn't already told it to me. But it was amazing how he could accurately tell these stories, yet show symptoms of Alzheimer's and recognize people from his past. But eventually, that long-term memory would also go away. I'll never forget the day when my father watched a video I had made on his light and did not know who the man in the video was. I made this video to remind him of what he did in life, and we showed it at his 70th birthday party. At first, the video was familiar, but the day came, as I said, when he did not remember who he was or what he did in life. And that was painful for all of us. This journey is painful for everyone, including the patient. Aphasia. It's the loss of ability to use language. My father was an avid speechwriter for many presidents, author of many books, and an eloquent speaker. I was amazed early on when he was showing some symptoms, yet he could be interviewed on television and not miss a beat. But in time, that would change. My father also wrote a weekly column for his hometown newspaper. My mom and I began to notice that we had to correct and edit everything he sent out, and then eventually he was not able to use language at all. Apraxia. It's the loss of motor skills. Fine motor skills will be lost first. They may have difficulty brushing their teeth or buttoning a shirt, as well as being a bit clumsy with large motor skills. Eventually, towards the end stages of this disease, they lose the ability to swallow. The brain is having difficulty carrying out normal movements and activities. Agnosia. This is the loss of ability to recognize things through sight, sound, taste, touch, and smell through our senses. They may see your face but not recognize you. They might not be able to cook because they can't figure out how to turn on the stove, or worse, how to turn it off. Apathy. It's the loss of ability to take initiative. My father was the Energizer Bunny for most of his life, a type A personality who worked hard and was always on the go. He took initiative until this disease progressed. He could sit in a chair and get nothing done while giving you that blank stare. If you walk into a room, though, and forget why you went in there, or stumble over a word when you're making a speech, don't be concerned. Welcome to the aging process. These things are normal as we age and are not symptoms of Alzheimer's disease when they happen occasionally. Number 2, there is no known cure for this disease. A doctor can give you drugs such as Aricept to slow down the progression, but sometimes this drug does nothing and sometimes it helps. A doctor can give you Ativan to help control the anxiety that comes with sundowners in the afternoon. It's hard when your loved one is diagnosed with a non-curable disease that you can do nothing about but manage some of the symptoms. Number 3, 90% is lifestyle cost. This may be hard to believe, but there are many risk factors for this disease, and I've done a video that you will want to watch. It's called 7 Research-Backed Tips to Prevent Alzheimer's Disease. It will be referenced in the show notes below, and you will want to see this video. Now, there is a genetic mutation called APOE-4, but only 5 to 10% of people with Alzheimer's have this mutation. According to neurologist Aisha and Dean Sherzai, 90% of cases of Alzheimer's are preventable. Since there is no cure, the best way to handle this dreaded disease is to prevent it in the first place, and I cannot emphasize this enough. Number 4, hard to believe, but women are twice as likely to get Alzheimer's than men. The facts don't lie, but the reason why is largely unknown. Now, some researchers think it may be because women lose estrogen levels during menopause, and estrogen is brain protecting. But further research needs to be done in this area. Number 5, vitamin D can cut risk by 40%. A research study published in March of 2023 revealed that vitamin D exposure in supplementation form was associated with a 40% lower dementia incident versus no exposure. This study even found that vitamin D has potential for dementia prevention, especially in the high-risk strata, which means those who are the carriers of this APOE-4 Vitamin D is known to participate in the clearance of amyloid beta aggregates and may provide neuroprotection against amyloid beta-induced tau as well. Vitamin D benefited females more than males. There is a new blood test on the horizon, according to the Mayo Clinic. It's FDA approved, and it's the first tool to help diagnose Alzheimer's disease. And it started in May of 2025. This test is called Lumipulse. It measures certain proteins, including a specific form of the tau protein that can indicate the presence of amyloid plaques in the brain. Amyloid plaque is considered the hallmark sign of this disease. This blood test can actually detect changes even before memory problems begin. Previously, invasive and expensive tests like a PET scan and lumbar puncture were the only test to detect Alzheimer's disease. The test is considered 90% accurate and is usually now paired with imaging scans. You should discuss with your doctor if this test is appropriate for you, especially if you've been through this disease with a family member and have a healthy fear of developing it because catching it early is key. It is important. And the symptoms may show up later, but actually goes back to 20 and 30 years ago, the progress beginning. Number 7, 1 in 3 older adults dies with Alzheimer's or another dementia. Alzheimer's kills more than breast and prostate cancer combined, and over 7 million Americans are currently struggling with this disease. But it is estimated that by 2050, 12 to 13 million people will have Alzheimer's disease. More than 1 in 9 people age 65 and older has this disease, but that percentage increases with age. 35% of people 85 and older have this disease, and it ranks 6th in the cause of death or mortality. Number 8, costs can exceed $111,000 per year. My father had the disease for about 10 years. Now, we were able to keep him at home for the first 5 years. At the second year, we signed him up for some days in a daycare center to give my mom a break. And at the end of the third year, we added a sitter during the day so my mom could have some type of life during the day and get some things done. But by the end of the 5th year, my mom, sister, and I were exhausted, especially my mom and my sister because they lived there, as his care became 24 hours a day and the sundowner episodes harder to manage. The last 5 years, although it was hard, we felt the need to put him in a dementia center. Why? To save my mom. We waited until he did not know who we were. I can remember crying outside that center that day. It was hard on all of us. And later that day, when I arrived at a counseling conference near the coast, I sat in the back of the room because I could not hold back my tears. Another counselor came over to comfort me. I told her why I was upset. Her father also had this heartbreaking disease. She put her arm around me and she said, "It's the hardest thing you'll ever have to do. But I believe you'll see in time it was the right thing to do." And she was right. There may come a time when you can no longer manage your loved one at home. Instead of caring for them full-time 24 hours a day, you'll be assisting with their care while someone else shoulders the 24 hours a day. Oh, we didn't stop caring for my dad. My mother and sister who lived nearby were there, one of them every day, and I visited him on the weekends. My mother was there almost every day up until the end. He was never without someone being there during the day. In 2007, the cost for 24-hour care and supplies hit around $80,000 a year. Today, those same costs, including supplies, would be around $120,000 per year, if not more. It's expensive. Number 9, let me give you some hope on the horizon. It's not hope in a pill form or medical treatment, although that may come one day. It's hope from several doctors in our country who specialize in underlying causes of this disease. They are beginning to make strides in reversing this disease or holding it at bay if caught in the early stages. Dr. Dale Bredesen, a research neurologist who graduated from Duke Medical School, is one of those giving hope. He has identified 36 underlying causes that can be tested, and if fixed, progress can be made. It's called the Bredesen Protocol, and it's a comprehensive, personalized program targeting over 36 metabolic, nutritional, and environmental factors. Dr. Mary K. Ross uses the Bredesen Protocol, and she practices in Savannah, Georgia, and also in California. Dr. Heather Sanderson practices near San Diego and also follows the Bredesen Protocol. And Dr. Sanderson is doing her own research as well. These doctors will do a series of tests, which are usually paid for by insurance. However, their medical fees and excess hours are paid out of pocket. They are treating the root cause, not just symptoms. As a result, their fees for all their time can get expensive. Now, when I recommend that people look at this option, many shy away due to the cost. But in my opinion, the medical costs are far less than what this disease will cost them in the long run when they have to go to 24-hour care. And you've just seen how expensive that is. I wish I had known this information when my family needed it. After all we went through, I did set up an appointment with an integrative medical doctor for this one reason. I wanted to avoid this horrible disease. According to a screening paper and pencil test of questions by Dr. Vincent Fornesky, head of neurology at UCLA, I was high risk for getting Alzheimer's in the future. Thankfully, those risks have been diminished as I've changed my lifestyle, not just for cancer, but also to prevent this. I hope this has been helpful information for you. Prevention is key in this uncurable disease. We must realize that when we're showing symptoms, the body changes inside our body and brain. Go back 20 and 30 years. Now is the time to begin a plan of prevention. Period. This is not a road you want to go down. Until next time, may God bless. And may God give you the initiative to prevent heart disease, cancer, and also Alzheimer's and dementia. Why? So that we can serve Him until the day He calls us home. May God bless.